Ladies and gentlemen, many of you probably heard by now, America has reached another milestone in COVID deaths. So we are still in the fall, and America has already reached 250,000 deaths. And this has not even been a year, we're just in 10 months from the time of the first lockdown back in March to now. 250,000 deaths. So this is NPR, November 18th, 2020. The United States has surpassed yet another devastating milestone in an ongoing COVID-19 pandemic. 250,000 Americans have now died from the disease. That's more than twice the number of U.S. service members killed in World War I. Coronavirus cases, numbers are exploding across the country at the beginning of what is shaping up to be a difficult winter of illness in America. Unfortunately, we are entering what I think will be the worst stretch that we have experienced so far, said Caitlin Rivers, an epidemiologist at the Johns Hopkins Center for Health and Security. We're seeing hotspots across the country and new highs for the number of cases and hospitalizations. Wow. So, a lot of places that were hot spots in the beginning of the year, it's raging in those areas again, like New Jersey and New York, California, and now Texas is actually exploding there. They actually have more cases and deaths than California now. And it's exploding again in Florida. And you got that idiot governor down there talking about the Super Bowl. So go figure. So in the past week, 36 states and one territory set records for daily new confirmed cases, and 12 states saw a day with the highest number of new deaths. The virus is currently hitting the middle of the country especially hard, with the highest number of cases per capita in North and South Dakota. Isn't that where they had the bike rally? South Dakota, Minnesota, Wyoming, Wisconsin, Iowa, Nebraska, and Montana. More than 76,000 people are currently hospitalized with the virus, according to the COVID Tracking Project. With cases spiking, more deaths will follow, but advances in medicine in recent months have improved the odds of surviving COVID-19. The infection fatality rate is declining by about 30%. The rate measures the fatality of those who are infected, not only for those who are diagnosed, by using antibody test data to understand the prevalence of the virus at a large scale. And the infection fatality rate is falling in all age groups, including the elderly. Doctors and nurses have more experience dealing with COVID-19 and anticipating its complications, and there have been advances in treatment and triage. Unfortunately, that decline in the infection fatality rate comes as winter arrives and more hospitalizations and deaths are expected. The virus loves the cold, and people are also moving more of their socializing indoors as temperatures drop. Now more infections are happening among family and friends in home settings. These are the people you trust the most. You feel like they're not going to hurt you. And we see a lot of people not wearing masks, not paying attention to safe distance. The virus is more likely to stay in the air and more people are likely to get infected indoors. So we're in the trajectory of the coronavirus, according to the health metrics and evaluation latest model. By March 1st, the US may see nearly 439,000 total deaths from the COVID 19. Wow. So, this is what they're projecting. If the government mandates to limit the spread or ease, the model projects the deaths perhaps will be 587,000 by March 1st, if anyone in the US. So they're saying, at this point, if everybody would, wear the mask every time they're in public, they could anticipate seeing the casualties drop to 371,000. While the virus continues to rage in communities across the country, much has been learned about the virus and how to treat it. Doctors have learned to put patients on their stomachs, known as proning, to ease breathing difficulties. Oh, really? A steroid. Yeah, it's that same steroid that Trump got. They're saying that has been good in treating the illness in people that have a serious and more severe case of coronavirus. Okay. And that's dexamethasone. That's the name of the steroid. Okay. Every day we learn about, I think, we're treating it more effectively. And this is Ryan Taub, an emergency medicine physician in Fort Lauderdale. Patients were first coming in with any kind of respiratory symptoms. The recommendation was to have them put on ventilators right at the get-go. But now they're saying, you really got to be critical for them to send you to ICU and onto a ventilator in the US. Okay. We had patients with delayed heart attacks who stayed at their home for 3 days with chest pains, thinking, oh, they believe it's just going to go away, and they don't believe it's COVID. And actually, COVID can, it can cause chest pains. In fact, that happened to my uncle's wife in Florida, and she had to be hospitalized for 1 day. And they told her that was like an after effect of having COVID. So she stayed 1 day and the chest pains went away and they just sent her home. And she's been okay since. So, the article goes into the vaccines, and I've done individual videos on that. So I'm not going to really go in depth. But they are in fear of Thanksgiving becoming a super spreader event in the US. And upticks have been seen consistently every single holiday: Memorial Day, Mother's Day, 4th of July. Each time people gathered for those kind of holidays, there was a surge in the country. So, ladies and gentlemen, be careful. Be careful about who you're around. We're in tough times and it's going to get worse as we move into the winter. And I know I told y'all before, they told the Northeast people in this region, we can easily become the epicenter in the country again this coming winter. So all we can do is the best that we can and trying to, get through this, because there's nothing we can do but get through it at this point. It's not like you can escape it. It's worldwide. COVID is bearing down on the entire earth. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.